what is shoulder flexion. And what you're going to do is you're going to have your patient sit. They're going to put their arm at their side with 0 degrees of abduction, flexion, and extension. Their elbow is going to be an extension with their palm towards their body. First thing you want to have them do is you're going to have them show you the full, see if they can get the full range of motion against gravity. So I can have you do flexion for me. And it looks like Sam can do that, so that would mean she's at least a 3. So when you do this test, you have to stabilize on the shoulder, but you have to be really careful not to put a whole bunch of pressure on it, because you can push on the fibers of the anterior deltoid and cause it to like restrict the motion. So you have to stabilize, but you can't put too much pressure. And then you're going to put your resisting hand is going to be proximal to the elbow. So I'm going to go ahead and I'm going to have you do that motion. And don't let me push you down, Sam. And I put a pretty good force there, so she would be a 5 because I couldn't break her. If she couldn't do this motion, I would have her lay inside line on the table. That way, please. And you're going to have a table with a towel on it or some surface for her to put her arm on. And then you are going to stabilize once again, but you have to be careful again not to put too much pressure on it. And you're going to palpate on the anterior deltoid just to make sure that there's a contraction there. So you go ahead and do that motion for me, Sam. Good. And there's a contraction. If there wasn't, she would be a 0. If there was a contraction but no motion, she would be a 1. One thing you have to watch for is you don't want your patient to do external rotation when they're doing this, because it's going to change the way that the joint works. And then you want to have a towel to prevent friction, and you have to always make sure that you stabilize. And that's it.
The muscles you tested were what?
The anterior deltoid and the coracobrachialis.